So early testing is extremely important for anyone who is experiencing these symptoms. You really want to get the message out that these aches and pains are not just signs of getting older.
Thanks, Julie. No matter how old you are, you have to listen to the warning signs your body is giving you. Simple, painless testing is the best way to discover PAD, and treatments can actually make walking enjoyable again. We'll tell you more right after today's Healthy Body, Healthy Mind Q&A. What percentage of people with diabetes will develop peripheral arterial disease? Answer B. 50% of people with diabetes will eventually develop PAD. So early testing for PAD in patients with diabetes is essential. Now more about treatments from Carlos Bain.
The tests used to evaluate for early PAD are non-invasive and involve measuring blood pressures in different parts of the body.
Your family doctor and your general practitioner, for the most part, are familiar with the simple tests for detecting PAD, especially in its earliest form. These tests are usually non-invasive and simply involve measuring the blood pressure at the ankle level and comparing it to your arm blood pressure, or in diabetics to measure the blood pressure in the toe, which may require some specialized equipment.
If a patient needs more progressive testing, the ABI, ankle brachial index, is the advanced test for PAD and can easily be performed by a vascular specialist.
The ABI is very similar to taking a blood pressure. In fact, it is taking a blood pressure. But in this case, it's taking a blood pressure in the leg. A blood pressure cuff is put around the ankle and inflated just like a blood pressure is inflated over the arm when we routinely take a blood pressure. And we can measure the blood pressure going to the foot. Now we compare that blood pressure to the blood pressure in the arm, and typically it should be the same.
Physicians can predict the artery blockage in the limbs and how severe it might be by the outcome of the ABI.
If the blood pressure going to the leg is lower than blood pressure in other parts of the body, over the brachial artery in the arm, then that suggests with a high degree of probability, in fact, 95% probability, that that patient has peripheral arterial disease.
Take the case of Richard McCabe. Over a decade ago, he had quadruple heart bypass surgery, and after a few weeks recovery, he was back living life his way with a few changes. He began watching his blood pressure and eating right. But a few years ago, he started feeling numbness and cramping in his feet and calves.
I'd say about 2 or 3 years ago, I started to feel a numbness in my feet. And then that went along with that. When I used to walk, I'd walk about half a mile and I'd get these cramps in the calves of my legs, which really bothered me. So I had to stop walking, and I'd rest for maybe 5 or 10 minutes, and then I'd start again. And it got to be such a nuisance that I've stopped walking because it has been a real problem.
Richard limits his exercise and takes medication to control his high blood pressure. He says that's enough, at least for now.
I suppose if I couldn't walk, my normal daily course, I would obviously have to do something.
In some cases, if detected early, PAD can be controlled with medications alone. But if patients have claudication, discomfort in the legs, and don't respond to medications, their quality of life may suffer, and that's when surgical and non-surgical procedures should be considered. Among them, angioplasty.
Angioplasty is a technique by which a balloon is passed to the site of blockage in an artery, and the balloon is then inflated and breaks up the blockage, at least temporarily. Many surgeons these days are now placing a stent, which is a metal spring that stays in the area where the balloon was inflated to provide some stretching force to keep that broken up obstruction open for a longer period of time.
This procedure worked well for Evelyn.
And that procedure requires staying because after you have the angiogram and they put them in, you've got to lay straight. We call that. You have to lay down on the bed with your legs straight out.
But if patients progress beyond intermittent claudication to the point where they are now at risk for having damage to or even losing their legs, treatment usually involves new blood flow to that part of the leg. This is called open bypass surgery.